everyone. I'm Dr. Chinyere A. Ugoji, MD, MBA, currently in clinical practice and research on domestic violence, and a master's in public health called social and behavioral sciences at Capella University, Minneapolis, Minnesota, and participants in the American mock interview session and graduate medical education application through the electronic residency application service 2015 with interest in healthcare, education, leadership, and public health. We submitted application through the electronic residency application service with submitted documents through the secure electronic residency application service system of the following documentation: medical students performance evaluation or dean's letter, medical school transcripts, letters of recommendation, photograph, ECFMG status report, USMLE transcripts, personal statements for internal medicine, family medicine, psychiatry, and pediatrics, and other documents which include the American International School of Medicine diploma, the American Board of Family Medicine score report, United States passport, Education Commission for Foreign Medical Graduate Medical Education certificate, American International School of Medicine transcripts, senior school certificates, examination from Owerri Girls Secondary School, United States medical licensing examination, step 1, 2, clinical skills, and step 3 score reports, United States medical licensing examination, certified transcript of scores, Imo State University School of Medicine transcripts, Owerri Girls Secondary School senior school certificate examination transcripts and diploma, licensing documentation verified and updated in 2014 with national licensing organizations. Welcoming you to Dr. Chiquito Mentoring Iridescence Global Collaborative Educational Ustream YouTube show, a Reach Higher and Let's Move initiative of the First Lady Michelle Obama. I would like to share these quotes with you. At each and every juncture of our history, somebody has been audacious enough to say, we could do better, and most often than not, it's been young people who have done it. President Barack Obama, February 2nd, 2007. This program will mentor and cultivate young leaders of today and tomorrow, and I am proud that they will have this opportunity to serve. I look forward to working with those who are selected to participate, and I want to commend all who apply for the desire to help to forge a brighter future for our country, to help through public service to forge a brighter future for our country. President Barack Obama on the White House internship, May 22nd, 2009. Education is the key to success for so many kids, and my goal specifically is to reach out directly to young people and encourage them to take charge of their futures and complete an education beyond high school. First Lady Michelle Obama, January 16, 2014. Education is the key to success for so many. It's indispensable to the success of every individual and is the motivating factor behind my graduate medical education curriculum review and interest in the Reach Higher initiative by the First Lady Michelle Obama, inspired by these quotes by the First Lady Michelle Obama, and a determination to focus on education. Dr. Chinyere A. Ugoji, MD, MBA, October 25th, 2014. I wish you good luck in your future endeavors, and except from a letter from Dr. Janet Albers, Program Director, Southern Illinois University School of Medicine, Family Medicine Residency Program, Springfield, Illinois. Dr. Chinyere Ugoji was noted to be kind and personable, and except from a letter of recommendation from Dr. Kimberly Baker-Janol, MD, Program Director, Henry Ford Internal Medicine Residency Program, Detroit, Michigan. Chinyere Ugoji is a Texas certified nurse aide currently employed at Friendship Home Health Agency, providing quality, compassionate, reliable care to the geriatric patients, working closely with the geriatric patients and their families as a paid healthcare worker. Chinyere Ugoji has good character, morals, and professional conduct, and we have no concerns about domestic violence or professional misconduct about Chinyere Ugoji. I recommend her highly for any position and to any individual, and except from a letter of recommendation from Friendship Home Health Agency. This is to inform you that Ms. Chinyere Ugoji was hired by Always With You Home Care as an independent contractor, and except from a letter of recommendation by Always With You Home Care, service at your doorsteps. Ms. Ugoji served a 1-month ophthalmology rotation in this office in 2006. She has shown herself to be an outstanding individual with a keen intellectual grasp of medical issues, combined with the compassion necessary to care for patients on a long-term basis. Many ophthalmology patients are elderly and not informed, and I was impressed with her ability to deal with this population. With a quiet yet confident and competent demeanor, she's able immediately to put patients and staff at ease. She works well with auxiliary personnel and is intellectually demanding. After a time in the office, she was totally familiar with workup and testing procedures, and she carried out her duties in an exemplary fashion. She also maintained a steady study schedule related to her monitored cases and diseases. I believe Ms. Ugoji will become a fine physician, and she has the qualifications to enter any specialty or field in which she may have an interest, and except from a letter of recommendation by Dr. Jetty Bonnet, MD. It's my pleasure to write this recommendation on behalf of Chinyere Ugoji for a residency position. I had the opportunity to work with Ms. Ugoji as one of my medical students. Ms. Ugoji participated in a surgery rotation with me at Northside Main Campus and Emory Comfort Long Hospital in Atlanta, Georgia. Her duties involved physical examinations, clinical assessments, and case presentations. Ms. Ugoji showed tremendous aptitude in grasping medical concepts, making associations and applying various theories. Her keen perceptiveness and diligence as a student allowed her to make valid judgments and assessments when called upon. As part of her evaluation, Ms. Ugoji was required to present case presentations during our didactic sessions before and after patient examinations. I was most impressed with her clinical acumen. She made accurate clinical observations and formulated good management plans. In addition, Ms. Ugoji had excellent rapport with the patients. She was not only able to attain the necessary information from them, but also to put them at ease very quickly. Her excellent interpersonal skills extended also to her colleagues and to my office staff. She was well respected by her peers and others she came in contact with in my office. Besides the requisite skills Ms. Ugoji possesses, she also brings a compassionate spirit and insatiable desire to succeed. I support her for residency training without hesitation, and except from a letter of recommendation from Dr. Obu's case, MD, FACS. I am writing this letter with great pleasure on behalf of Chinyere Ugoji for a residency position. I had the opportunity to work with Chinyere Ugoji during the period July 7th to July 31st in my family practice and pediatric office and the professional office at St. Elizabeth Hospital, Chicago, Illinois. She worked under my supervision as an expert seeing adult patients and pediatric patients. She did case presentations, performed vital signs and weights, and presented various topics. I was impressed by her history-taking skills and ability to quickly establish a rapport with the patients. She participated actively in combining the signs and symptoms of various diseases to arrive at differential diagnosis and treatment regimen. She exhibited outstanding clinical knowledge. She made accurate clinical observations and came up with good management plans. Chinyere Gostogoji came across as a very hardworking, reliable, and intelligent young lady who will make a very good resident in any residency program. She was also able to develop good rapport with the pediatric patients as well as adult patients. She exhibited professional behavior and was willing to go the extra length to learn and to help others. She also exhibited excellent interpersonal skills towards her colleagues and office staff. She was viewed with respect and affection by her colleagues, staff, and residents. I have no doubt that she will excel in residency. I think she'll make a good physician. And except from a letter of recommendation from Dr. Saida Zahibi, MD, Program Director Emeritus, St. Elizabeth and St. Mary's Family Medicine Residency Program, Chicago, Illinois. It's my pleasure to write this recommendation on behalf of Chinyere Ugoji for a residency position. I had the opportunity to work with Ms. Ugoji as one of my students during February 2006 to March 2006. Ms. Ugoji participated in a surgery rotation with me. I apologize. Going to the next letter of recommendation. I am writing this letter in support of Ms. Chinyere Ugoji's application for residency. I have had the opportunity of working with Ms. Ugoji as her attending physician during her family medicine clerkship. During the 8 weeks of the clerkship, my interaction with Ms. Ugoji was quite enjoyable. She was a hard-working student who was very eager to learn. She impressed me with her maturity, ability to be a team player and to go the extra mile. Her personality was very pleasant and she was well liked by the staff. Ms. Ugoji always carried out her assignments and conducted herself in a professional manner. She was well respected by the other students and was a great example for the other students to follow. I was very impressed with her enthusiasm for learning and improving her clinical skills. Her clinical presentations were very good and she presented them in a timely manner. Her write-ups were very well written and very legible. Her fund of knowledge was solid for her level of training and her presentations were. In closing, I am recommending Ms. Ugoji to you with great enthusiasm. Ms. Ugoji will be an asset to any postgraduate training program. And except for the letter of recommendation from Dr. Otis Powell, MD. I would also like to share my biography with you. But I would take a few minutes to fix some technical issues. I apologize for the break in transmission. You are live on Dr. Chiquito Mentoring Iridescence Educational Global Collaborative Ustream YouTube show, a Reach Higher and Let's Move initiative. So I would like to share my biography with you. The brain, a powerful tool for creating the future. The stethoscope, an astute diagnostic tool. The book, the final piece of the puzzle in creating education. Why did I choose to become a physician? Maybe because I was born a leader. Maybe because I like helping people. Maybe because I think it makes me cool. Maybe because I feel I can be a source of succor, a balm in the midst of disease, poverty, and mental anguish. To be a physician, you have to have a sincere love for people and a sincere desire to help people. 2003 till date, Masters in Public Health, Core Social and Behavioral Sciences at Capella University, Minneapolis, Minnesota, and a current project on domestic violence. Graduate Medical Education Application, White House Leadership Application, Non-Licensed Physician, Graduate Medical Educator, Community Educator, Caregiving Certified Nurse Aide, Patient Care Technician, and successful completion of neuropsychiatric evaluation, clinical skills, objective structure clinical skills evaluation, clinical skills workshops, advocacy with the American College of Physicians, American Academy of Family Physicians, American College of Obstetrics and Gynecology, American Psychiatric Associations, American Pediatric Associations, Dr. Chiquito Mentoring Iridescence Education and various collaborative organizations. May 2008 to September 2013, Masters in Business Administration, Core Public Health Administration at Davenport University, Transverse City, Michigan. March 2012, Psychiatry Research from University of Texas Southwestern Psychiatry Department with Dr. Carol North, MD, and then Downs, MSW, on psychoeducation and hepatitis C and alcohol behaviors. 2010 to date, research on psychiatric, cultural, and contextual arbitration in domestic violence with personal experiences integrated into psychiatry research experience from University of Texas Southwestern Psychiatry Department with Dr. Carol North, MD, and then Downs, MSW. And behavioral science rotation from Southern Illinois University Family Medicine Residency Program, Springfield, Illinois. May 2012 to date, separation, legal divorce. March 2011 to May 2012, graduate medical education at Southern Illinois University Family Medicine Residency Program, Springfield, Illinois. After the National Residency Matching Program, paramount to interviewing at various graduate medical education programs as a pregnant intern, marking the success of the training examination using the program director, Dr. Janet Albert's MD's lexicon, and completing clinical rotations in surgery outpatients, community medicine, behavioral science, family medicine training service, obstetrics and gynecology, continuity clinic, didactics, neuropsychiatric evaluation, successful completion of objective structured clinical skills evaluation, and termination of residency contract, conglomerate of graduate medical education. December 2010, graduate medical education at Huntsville Family Medicine Residency Program and Family Medicine Training Service with Dr. Mary Cristani, MD, the program director. July 2010, graduate medical education at St. Elizabeth and Mary's Family Medicine Residency Program in Family Medicine with Dr. Saida Zahidi, MD, program director emeritus. May 2010, medical education at Harris Fort Worth Methodist Hospital, Fort Worth, Texas, in internal medicine with Dr. Fidelis Uneni, MD, and internist. July 2010, successful completion of United States Medical Licensing Examination, Step 3, with a score of 88 or 212. March 2009 to September 2009, Graduate medical education at Henry Ford Internal Medicine Residency Program, Detroit, Michigan, paramount to interviewing at 21 graduate medical education programs nationwide, completing clinical rotations in pulmonary medicine and critical care medicine with Dr. Alvin Bowles, a pulmonologist and critical care physician, and in family medicine training service with Dr. Kimberly Bekajinor, the program director. Continuity clinic, didactics, neuropsychiatric evaluation, and termination of residency contract, conglomerate of graduate medical education. August 2008, United States naturalization and citizenship. June 2003 to December 2007, Doctor of Medicine, American International School of Medicine, Guyana, graduating on the Dean's List magna cum laude in 2007. August 2007, successful completion of the United States Medical Licensing Examination Step 2 clinical skill, Step 2 clinical knowledge with a score of 98 or 237. June 2007, successful completion of the United States Medical Licensing Examination Step 1 with a score of 88 or 212. 2003, United States of America green card with the United States of America diversity visa lottery, January 1998 to February 2003. Medicine and Surgery, Imo State University, Nigeria, first 10 admission and scholarship, January 1992 to December 1998. Secondary school, high school diploma, Owerri Girls Secondary School, Nigeria, 9As and 7A1s. January 1986 to December 1991. Primary school, Unity Primary School, Owerri, Nigeria, first top 3 students and admission to secondary school for primary 5. I would also like to share my personal statements with you. My choice to be a physician stems from educational and physician leaders from early developmental years to graduate medical education, and real life stories of patients whose life have been transformed by healthcare in my family, patient care, and various charity works, and be a part of effective, innovative, cutting-edge healthcare delivery. Hello everyone, I'm Dr. Chinyere Goji, MD, a 2007 graduate of American International School of Medicine. My typical introduction to community educational youth stream shows discussing the quintessential skills for patient encounters and components of the clinical decision-making process, and the role of graduate medical education curriculum with its diversified topics ranging from emergency protocols, patient encounter, coding and billing, electronic health records and practice management, contributing towards effective healthcare delivery. Healthcare integrates the fine arts of addressing patient symptoms and physical examination findings, integrating humanitarian qualities, pharmacology, and psychotherapy, which have worked in the past. Healthcare reform with continuous innovative healthcare delivery, creating healthcare opportunities from the United States of America, Taiwan, Africa, and Russia with healthcare professionals, systems and health information technology with personalized patient-centered approach, didactics and healthcare delivery systems. Specialization opportunities makes hematology and oncology, my choice of specialty. And this is an excerpt from my internal medicine personal statements. My family medicine personal statement also talks about my interest in obstetrics and gynecology as a specialty, with cases ranging from cerebral palsy to sexual violence to pregnancy, preeclampsia, rheumatoid arthritis, which we'll discuss further down on this show on Dr. Chiquito mentoring iridescence educational global collaborative Ustream YouTube show, the Reach Higher and Let's Move initiative. And my personal statement ends with this synopsis portray a typical day in the life of an intern with patient care armed with accreditation council, graduate medical education, core competency training from medical school, supervised by a resident, while maintaining a balanced life with hobbies and a healthy mental and physical habits, which I hope to contribute by providing a collaborative environment for graduate medical education and awareness about education and preventive health with the Reach Higher initiative of the First Lady Michelle Obama, with my hobbies of Zumba dancing and charity works on Dr. Chiquito mentoring iridescence education Ustream YouTube Cisco WebEx show, and resumed custody of my 3-year-old son as a single mother while achieving my goals of graduate medical education training. My psychiatry personal statements also discusses my interest in psychiatry, and I'll read some excerpts from my psychiatry personal statements. Patient, which talks about two clinical cases on domestic, on sexual violence and also on depression. Yeah, Dr. Chiquito mentoring iridescence healthcare practice offers counseling for victims of depression. So it talks about a case of an individual who had of two individuals with depression and also a victim of sexual violence, and patient education during the clinic visit on the role of neurotransmitters acetylcholine and catecholamine, dopamine, norepinephrine and epinephrine, also called adrenaline, and corticotropin releasing factor CRF, a stress hormone and neurotransmitter, lifestyle modification of integrating family support, community involvement, hobbies and a healthy lifestyle, and medication compliance and continuity of care is essential to ensure physical, mental health, psychotherapy and counseling with several approaches including cognitive behavioral, interpersonal and talk therapy help in depression. Psychotherapy helps people identify the factors that contribute to their depression and deal effectively with the psychological, behavioral, interpersonal and situational contributors. Skilled health and mental health professionals such as licensed psychologists can work with individuals who are depressed to pinpoint the life problems that contribute to their depression and develop problem-solving skills and identify negative or distorted thought patterns that contribute to feelings of hopelessness and helplessness that accompany depression, and develop skills which include developing or strengthening social networks and creating coping mechanisms and lifestyle changes. And this is an excerpt from my psychiatric personal statements. These personal statements, for copies of these personal statements, contact me at my email or my phone number, and I can be able to share these personal statements with you. So today we're gonna go to the next section of the show, which is which is the graduate medical education interview session for those of us who are going through interview season, through interviews right now, and we have been talking about the commonly asked graduate medical education interview, interview questions that you encounter even as you are on the expedition for the perfect fit for your graduate medical education needs. And we have talked about the various questions for the interview, for the interviewer and also the interviewee. So the question for the interviewer, which could be the program director, the faculty member, the residents, the medical students, and also or the staff, would be, are there any formal mentoring programs for new residents, and the faculty serve as mentors? This is a good opportunity to learn about the various formal mentoring programs available for new residents. Most programs assign faculty members to be mentors to the residents who work closely with the residents throughout specified periods, with feedback and evaluations, verbally and written, which contribute towards the residents' personal portfolio for career development, which I have experienced personally in my graduate medical education career, and constitutes part of my graduate medical education curriculum review. In medical school, my mentors were medical educators in clinical rotations. From externships and observerships, my mentors were program directors and medical educators. At Henry Ford Internal Medicine Residency Program, Detroit, Michigan, my mentors were the program director, Dr. Kimberly Baker-Junor, MD, now emeritus, the various faculty members, residents, medical students and staff at Southern Illinois University School of Medicine, Family Medicine program, Springfield, Illinois. My mentor was Dr. Nicole Miroka, MD. And my accreditation council of graduate medical education core competencies in patient care improved, working with the various mentors in medical knowledge, practice-based learning and improvements improved. My coding skills actually improved tremendously, and I got a book with instructions from the program director at Henry Ford Internal Medicine Residency Program, Detroit, Michigan, about coding in healthcare. My accreditation council of graduate medical education and core competency in system-based practice also improved. My knowledge in electronic health records improved tremendously. Working with my mentor, Dr. Nicole Miroka, my note writing skills improved. Working with the various various mentors and various faculty. My skill in professionalism also improved working with the various faculty members. I was reinforced at Southern Illinois University Family Medicine Residence Program, Springfield, Illinois, and my skill in interpersonal skills also improved. In interpersonal skills and communication also improved tremendously. And my core competency skills have improved across the years in graduate medical education. So this is very important, a very important question, and in which you need to learn about, even as you undergo the expedition for the perfect fit for your graduate medical education needs. And now we'll go to the next question, which is the question for the interviewer, which could be you or me, even as we are on the expedition for the perfect fit for our graduate medical education needs. And that question would be, what can you offer graduate medical education? Education. And my answer to that question would be, I can offer graduate medical education dedication to healthcare, medicine, education, and collaborative teamwork within the next 1 to 3 years. And with that, we are gonna end the show. But I would just want to let you know that virtual rounds, which occurs every Tuesday, is going to occur on Friday by 8 o'clock. And we'll talk about healthcare news, healthcare in Spanish, and also the overview of phone collaboration with graduate medical education programs, with statistical analysis of the recruitment process, and also of the graduate medical education program with my research data on these programs. I will talk about some specific information, including the mission and the goals of the program, and also the welcome messages of the professor or chair, the program director, the faculty, the residents, and also the staff, and also the structure of the curriculum, the application requirements, the application modalities, and also about the city, the housing in the city, the major industries in the city, and also social life in medical education. So we are going to bring you in-depth data on this research coming up on Friday, and we also have the Let's Move initiative with Zumba dancing to move like Jagger, and also I'll bring you information from public health. I'm currently enrolled in a master's in public health called social and behavioral sciences at Pepperdine University, Minneapolis, Minnesota. And my knowledge in public health is improving tremendously. I completed the leadership class, and I'm taking my second class with classes tailored to complement my knowledge in graduate medical education when applying for residency. I got an A in my leadership class, and I would just want to leave you with some tips in how to succeed in classes, and I which I hope can be able to also help you even as you are in education, and that includes submitting all assignments on time, working with your instructors and advisors, Incorporating feedback. Do not repeat mistakes that have been pointed out. And Capella University has good a good curriculum, instructors and advisors, and I would recommend it highly for anyone in their in their career path. And with that, I want to end this show today. It's 8:43 a.m. Central Time, and I want to wish you a wonderful interview day, even as you are on the expedition for the perfect fit for your project medical education needs. And I want to wish you a wonderful day.